I'm drinking my Celsius. I needed a kick. It's got a nice background. That's beautiful with the fireplace. Where are you? Where are you located?
Denver, Colorado.
Oh, it's cold still.
Yeah.
Oh no, it's gonna be in the 90s this week.
I know.
All
More
right.
for ambiance.
It was cold here. It was like 70 something.
Ooh.
Wow.
It was 90. No, today is 82. Beautiful.
Nice.
We'll go ahead and get started. Hopefully everyone can hear us. Sorry, we're having our own conversation here, but I want to say welcome. Again, I'm Katie Richardson on behalf of the AngelMD team. Welcome to our Marketing Masterclass series. I think we're on number 3 now, but we are excited to see that at least 5 of you are still joining us on a regular basis. We have some great speakers here today, and I think we'll have plenty of time for Q&A. So I'll go ahead and let Tobin kick us off. I think he's gonna do a poll and talk about Zoom for a minute if we have any questions.
Yeah, kick off a little poll here. Take a second and answer those questions if you get a chance. And welcome everybody. Glad to have you here, and want to thank our guest, Dr. Posner, down in Florida, and really appreciate him jumping on with us. He is a friend of a number of folks in our network, but including Dr. Buford, Dr. Greg Buford, who some of you know is a good friend of the company. And we are going to have a little bit of fun today, and always want to also thank the Halo Creative Labs team for putting this on. So there is our poll. Have you joined the Slack channel? Yes. Have you used Slack before? Some yes, some no. And it's really an experiment using the Slack channel, because what we're really trying to determine is how useful are groups, because this is a functionality that we are looking to build into the AngelMD platform. And so we're using Slack as a little bit of a testing ground. So with that, I am going to turn it back over to Dave and or Katie. I'm not sure which one of you is going to kick us off.
Yeah, I'll kick it off. Thanks for joining, everybody. We had the opportunity to pre-record an interview with Andy Boian, who's the CEO of Dovetail Solutions, nationally renowned PR firm and crisis management firm specializing in communication. So they've been working with a lot of clients over the last few weeks, as you can imagine, with regard to the COVID crisis. And he's got a few tips and tricks to share with us. And it's more of an interview format today versus a presentation from the last couple of weeks. So I'll go ahead and share my screen, play that. It's short, and then we'll come back and continue. 1 second. Well, I got to redo that. All right, here we go. Welcome, everybody. This is Dave Farmer with Halo Creative Labs. I was guest speaker a couple weeks ago, and in talking with AngelMD, I realized that there was a personality that we might need to get on these podcasts, these webinars, and that is Andy Boian from Dovetail Solutions. He is, well, Dovetail Solutions, his firm, founded in 2005, 2006, somewhere in there.
2005. Yep.
Yeah, full-service professional communications firm specializing in media relations, branding and messaging, crisis and issues management, which is a hot topic right now, and public affairs. I should note that the firm was recently named the Public Relations Society of America as their firm of the year. Big deal. So these guys are nationally renowned. Andy has quite a resume, and pretty interesting one at that. We'll send out the bio there in full. But Andy's joining us today to just have a discussion around how to handle communications to patients, staff, and your community at large as this COVID-19 crisis continues. Andy, maybe to start off, tell us a little bit about Dovetail and your work in general as a PR firm and as a crisis management firm.
Sure. Well, first of all, thanks for having me, Dave, and I appreciate the time for sure. I will just say, we have a unique opportunity right now as a communications firm built 15 years ago, largely as a full service, sort of soup to nuts, everything from media relations, as Dave, you alluded to, working through issues regarding public image and brand. But then we quickly found ourselves inching into issues management and crisis. And when people say crisis, really, they talk about, spur of the moment, have to resolve something right away. It doesn't always mean something tragic or something, that's death inducing at all, but it is something that has to pay a particular attention. So Dovetail in itself is a firm that has based itself on being timely, being reactive, being very proactive with clients, and also making sure that we do so with empathy and with compassion, especially these days where people are concerned about their health and their welfare, and they feel like they need to have a firm hand to guide them through this process. And what Dovetail does, and what we try to do with all of our clients, is go back to the basics of what you're trying to communicate, how effectively you're trying to communicate it, and to whom. And all of that put together is basically the crux of what we are as a firm.
Yeah, so what observations have you and your team had as this crisis has unfolded? I mean, you guys have a lot of clients. I mean, what kind of conversations are you having, and what are you seeing out there? Is that maybe some of the hot topics or whatever related to this?
Well, for sure, COVID is the number one topic that companies are looking to us to help communicate and resolve, at least communicatively, with their employee base and also with their client base. And it stretches from everything from prevention and preventative care to what happens if one of our employees has it, the stigma around that and what that means, and then also the contagion itself and how susceptible people are to getting it. So how do you communicate to patients? How do you communicate to clients, to fellow employees about what's next? So I can tell you, Dave, from really when this broke, we actually were hired to break it, the first story of the first case in Denver. And it happened at the Denver Country Club. And it was it was stigmatized instantly as, well, the club didn't do enough and they weren't careful enough and this guy got infected, when in fact, very early on, we had no idea what we were talking about. The club did everything they needed to do. It just happened to transmit from one place to another. And that's happening around the country. And so one of the keys, I think, to communicate this process and the observations we've made is entering into each communication we have with empathy and compassion, and understanding that this isn't all fact-based right now. There are a lot of facts that are just simply not available to us yet. And so being cognizant of that, being willing to admit what we don't know, and also being abundantly cautious about how to re-enter into what we considered a normal or civilized economy again. People are anxious to do it, but at the same time, those that are doing it with caution are doing it prudently, smartly, and it's not just elected officials. It's CEOs of companies. It's those folks that run organizations that are responsible for people's well-being. That's a really important component in all this. So where does communications fit in? Everywhere. It's everywhere throughout the entire process.
Andy doesn't like me to brag about him out loud. He's a humble guy, but he has worked with presidents and he has worked with governors, a lot of politicians, and notably Governor Newsom out in California. Andy and team have been involved with him through the campaign and now as an elected official. California is dealing with a lot of fear, and translating that down to these clinicians. So we're talking to
Sure.
physicians, clinicians, and I'll use dentists as an example. Dentists, they're going to deal with fear. Patients who would normally be flowing into their office on a daily basis are going to stay away because they fear the germs or the environment that now exists in a very highly contagious environment, right? Dentistry,
Sure.
You're working with mouth and saliva and all that.
Sure.
And so dentists have a particular concern, I think, and as do other clinicians, where their client base are just going to fear them and not show up. And this really is going to hurt or potentially hurt dentists financially. So from a communication standpoint, what tools or what advice would you have for dentists and others like that need to communicate to their patients? Hey, you know what? We have taken precautions. These are dentists. They're not necessarily media savvy. They're not press savvy. Getting this communication out there in a way that's convincing, empathetic, to use your word, to their patients. What advice do you have for somebody like that who's dealing with a very fearful client base?
Absolutely. The first is, and of course you know this and they know this as well, is to be understanding about the fear and to acknowledge their fear about it, and to not see it as a ridiculous sort of feeling, but more about I understand why you're nervous. Here's what we've done to protect you, and not just talk about it, but actually show them. So a dental office is a perfect example where you go in and you're dealing with saliva, which is how this contagion is moving around, and the ability to make very clear right up front, both in communication, but also in doing so, that things are sterile, things are clean, things are being recognized as potential hazards and are being mitigated. The fear factor, Dave, is a tough one to overcome. That's a really strong emotion for people, and it's hard to get by because they think not only are they fearful, but they think they're validated in their fear because of what they see on the news. And in this particular instance, media can be a tool that can be used proactively to help mitigate this circumstance, and also making sure that you're staying in communication with potential patients, with existing patients, to say, here are the things we've done, here are the steps we've taken, and by the way, we've had success. We're seeing patients, they're healthy, they're leaving healthy, they're fine, and we're looking forward to seeing you soon. And the human side of that is incredibly important, but not only talking about it, but actually doing it. That's a big piece of it.
Yeah, I think going along with that, the show don't tell, and I'll put in a little pitch for Halo Creative Labs in conjunction with Dovetail Solutions, and that is
Sure.
video. I mean, a lot of times these clinics or businesses are putting out a press release, or they're sending out an email. In this case, getting back to the fear, I think I would enjoy if I saw my dentist or my healthcare provider personally in a video, talking to the camera saying, hey, this is Dr. So-and-so, and they're in their practice, and they're showing the things that are in place. Like, here's how we're mitigating for this disease. This is what you're going to do when you walk in the door. This is how we're going to walk you back, and here's how our nurses and our staff are going to treat you. This is our process that we have in place. But to show that, I think would be very comforting versus just another email.
That's so true, and Dave, and I love the show not tell thing that you just said, because it's almost like when you go out and you make a major purchase on a house, a car, whatever, you want to see it, you want to taste it, you want to sit down, you want to feel it, smell it, understand every component of it. And it's the same with your health. You want to actually be sure that, even more so actually, you want to be sure that it's absolutely as safe as it possibly can be. And you and I would never take our children someplace that's unsafe. We would also not take ourselves or our wives in the same vein. So really having the chance, and Halo is, and I'm sorry to brag on you because you don't like it either, but I got to tell you, we only use you because you're the best. And if you put together a very simple video that says, here's what we're doing and here's why we're doing it, here's why we think it's so important, that goes a much longer way than something that's produced on an email or even in a telephone call. I mean, a video goes a long way. The visual parts of this is really critical.
I think you're allowing yourself as a practitioner to express this empathy, this more of a personal moment for you versus this kind of stoic, stale email. And I think this moment calls for that more of a personal connection as you're inviting these people back into your practice. Well, just we got like a minute or two left, but final thoughts just in general about crisis, handling crisis, and maybe one or two tips that you can throw out to business owners on the best things they can do to let people know that they're there and they're welcoming them back.
First thing to do, Dave, in a process like this is to have a plan. And I know that sounds a bit cliche, but right now, while people are opening their doors back up, while things are slowly starting to reopen, having an actually formative plan on paper or digital that can actually be followed by everybody on the senior team is absolutely critical. It's like a treasure map. Mm-hmm. It's like, trying to figure out where the treasure's out of a map is impossible. It's the same here. If everybody's going in a different direction or nobody knows what the direction is, it's a dangerous precedent. And so if you have a communications plan, it doesn't need to be, it doesn't need to be this great big long and, exhaustive plan, but it has to be a process-based plan that makes sense, that everybody can agree to, and it makes logical fiscal sense. Do that.
Yeah.
Second, I would say is once the plan is written, is to give the freedom of the people involved to do the work on the plan. So don't overstep, don't micromanage, but say you're responsible for X, please make sure this is done. You're responsible for Y, I'm counting on you to do this. And that's really where delegation comes in, and also where you don't feel as the doctor, or in your example as a dentist, you're not feeling automatically like you have to have all the control 100% of the time. You'll simply go crazy, and it's impossible, and things will get missed. Even if you're the smartest dentist or the smartest doctor in the world, things will naturally slip. So give people the authority, but have that plan in place. And then thirdly, once it's being executed, allow enough time for the execution to take place. So don't quickly judge based on early results, but let it play out a little bit, give it time to blossom, and allow people that opportunity to live it, and it'll work. If it's written well and everybody has agreed to it, that's the key.
I love it. Listen, I'm really appreciative of taking the time to speak to me, to speak to the whole audience here. Listen, everybody that's watching, can't encourage you enough to go to dovetailsolutions.com. Check out Andy, check out the firm. Every single individual at Dovetail across the country, they are just top notch. They're amazing people, and you could find no better partner when it comes to public relations, without a doubt. So Andy, thank you. Thanks a million. I appreciate it.
You bet.
And we'll talk soon. All right.
Okay. Thank you very much.
All right.
Be well.
Thanks. All right. A lot of thanks to Andy for sharing some of those tips. He's not available for Q&A, but he is going to answer questions on our Slack channel. So if there are any questions, we can post them there and he'll get back to you. But definitely check him out. Katie,
all right. Great. We're going to move on to our second guest today, Dr. Jason Posner. He is a highly acclaimed plastic surgeon. Looks like he did most of his training in New York, so Mount Sinai School of Medicine, followed by a general surgery residency, a plastic surgery residency, and a couple of fellowships in there too.
That's old stuff.
I'm thinking
20 years ago, 20-something years ago.
Life in training, it looks like.
Yeah.
Dr. Buford, do you have anything to add about Dr. Posner? Because I know you guys are tight.
Does it have to be positive?
We love Greg.
Let me add this. I've had the opportunity, the pleasure to work with Jason. Literally for several years on various ad boards. We're currently on the business advisory board for Real Self, but I've known him to be an industry leader. If you talk to Jason knows knows what's going on within this country, what trends to predict. What's going on internationally, and is really good at forecasting things. I probably reach out to him on a weekly basis asking, hey, what do you think about this? What do you think about this? Great resource of information. And bottom line, and don't get too big of a head, Jason, but guy. But what I like about Jason though is he's a straight shooter. He doesn't try to sound fancy. He doesn't try to sound he just doesn't try to sound uppity or anything like that. He's straight to the point. He tells you exactly the information you need to know, and that's about it. Plus, he's always makes me laugh. So, yeah.
All right. Well, on that note, let's let Dr. Posner talk to us about. Sounds like you haven't even closed your practice, but let's hear how you've been handling
I'll tell you the first
this.
thing. Get this dry cough. This sucks. This just sucks. It's like everyone says the same thing. Everyone walks in and they're like, this sucks. And I think the country is in various stages of getting back to life. Like my friends in the Northeast have a little bit of a longer route to recovery than we do in Florida. My friends in Georgia are already working. My friends in Texas are starting tomorrow. So the country's waking up at different times. We all have the same questions. We all have the same concerns. And it's not the situation that we were in a month ago. I was on calls with Greg, like what the hell do we do? Like, how do we apply for the PPP loans? And what do we tell our patients? And what do we do about our staff? And do we furlough people? Do we keep paying them? I think the questions are different now. The questions are, okay, what safety do we need to put into to our offices for recovery, when we're going to start? what changes are we going to make to our normal operating protocols to accommodate the tail end of this virus? What happens if things start up again? So I think, like, I spent this morning, I was in a meeting with my staff for about an hour going through some protocols that we're writing up for our staff. So I think we're in a different stage. In Florida, the governor's order expires on May 8th, and we hope to be back to operating on May 11th. Since this coronavirus started, I can't stay home because I would like shoot myself. There's only so much time I can spend on my Peloton or online or reading stuff. I mean, I'm bored to death. So I've been coming to the office every day for 6, 7 hours, 5 hours. We've been seeing some mostly follow-ups and occasional in-person consult with gloves on and masks on, but mostly virtual. Like today, I saw a couple of virtuals and I saw one live person who needed to come in. Other than that, we're ready to get started. And the questions that arise that we're all talking about is, what do we need to do for our office and what changes do we need to make? So if you want to kind of go there, we can start with that, or I'll answer anything else you want to work with.
I would love to hear about the changes that you're planning. And then to our attendees, if you have any questions for Dr. Posner, go ahead and put those in the chat and we can go with those as well.
I mean, the first thing that happened yesterday was I came into work on Monday and one of my staff members says, hey, Quest is doing antibody testing. So we all got tested yesterday. Insurance paid for it. We were all negative. Now, it could be false negatives. I was hoping to be IgG positive because that means I could go leave my mask off and run around and not worry about getting it again. But so far, it could be a false negative. We were all negative. The second thing is the first thing that's going to happen is we're not going to be at the same pace we were in before this started. On a normal patient day, I can see upwards of 60 patients for follow-ups and consults and injectables. That's not happening. No way in hell. So what's going to happen is we're going to slow it down to a reasonable pace. We're going to maintain some distancing in our waiting room. No one's going to really, no more than 4 people or 3 people in our waiting room at any one time. Mandatory masks, mandatory temperature. We're going to be seeing patients in the exam rooms with masks and gloves on. The patients will be wearing them. The staff will be wearing them. The staff will not be wearing their scrubs from the outside in the office. They're going to do their laundry. They're going to change their shoes. They're going to wash their hands a million times a day. We're a surgery office. We wash our hands a million times a day anyway. It's just going to be a little bit hyper than we're normally doing. The real question is what's going to happen in the operating room. My med spa is easy. Put your mask on, pull down your mask, we'll inject your lips, put it back on, you're good to go. But the operating room, we're only concerned about patients who are not symptomatic yet, who might be having the virus, who might be undergoing general anesthesia. I mean, that's the elephant in the room. And the answer is we don't know yet. We might, one, if they've been asymptomatic for 5 days prior to surgery and quarantine, they're good to go. I wish we had a rapid antigen test so we can test everyone right away. I don't think that's available yet. We might be doing some testing on them within 5 days to see if they're corona positive. But if they're IgG positive, I don't care. They're good to go. They're probably not going to get it again. So the only question is what additional pre-op testing other than screening do we need to do? And Greg and I have talked about this a little bit, and I'm interested to hear what he has to say. But basically, it's going to be slowing down, but kind of getting back to the normal speed, but at a slower pace. And then hopefully we'll be ramped up to maybe not quite previous levels by July. But frankly, you know what? I'm kind of liking not being on the treadmill. I might actually keep it slowed down a little bit. I kind of like it. I get to work out a lot. I'm way overtrained right now. If I do one more day on my Peloton, I'm going to be like even more sore.
I call it the hamster wheel. You got to take a step off the hamster wheel. Yeah. We have a question for you. So how are you addressing the employee who says that they don't feel safe coming into work, even with protocols in place?
Right. So I think that's a great option. And I don't think we should be forcing staff to do anything. So the question is, I don't feel comfortable paying them not to come to work. That's the other thing. I mean, if they want to go on furlough and go on unemployment or use their PTO time, that's fine by me. I can't force them to come into work. But, we've talked to our staff about this, and our staff wants to come back to work. We're a Surrey office, and we're used to blood and guts. So I think the staff is all smart and comfortable with gloves, mask, and eye protection on, and observing universal precautions and screening the patients. If you got a fever, you're not coming in the office. But certain stupid things like you can't come in the office with your kids anymore. You can't bring 6 family members to a consult. Come alone unless you're a minor. Bring your mom. But those are the simple things that we're going to do. I'm hoping that it's been like 6 weeks since we worked, so there's not going to be as many post-ops in the office right away. So that's going to naturally slow it down by itself. So, and there's a question, are we struggling to get PPE? No, we got plenty of stuff right now. We got masks, we got gloves, we got hats. We're good to go with that. But again, I'm not going to force anyone into coming to work if they don't want to come to work. But so far, everybody wants to come to work.
Yeah, we've heard quite a few folks. I know Mike was talking about earlier, or maybe this was Tobin actually, that California, definitely in Colorado. We heard last week that our dental colleagues are struggling. They were asked in the beginning of this whole thing to give up their PPE because of the shortages. And so some of them did that, and now are saying, okay, how do you expect us to open? And it's interesting because I think the leadership, the dental associations and everything don't seem to be thinking clearly, in my opinion.
I think our associations are coming through. I've gotten a lot of emails like we have PPE stuff available. We might need a change. Like I think the dental people should absolutely be wearing face masks because you're in someone's mouth and stuff like that. I'm more worried about the general anesthesia case who we have to intubate, who might have been just got exposed, and now we're shoving that stuff down their throat with positive pressure ventilation. I'm a little worried about that, but I think that our societies are going to come up with some guidelines for that. And there's a lot of back channel talk via text, via some of my friends who are pretty much among the leaders in the field. So these are the kind of things that Greg and I will text about. Hey, do you need to test? Should we do a test 5 days before surgery and tell them to stay home and don't answer the door? Don't check their mail for 5 days. I don't know if we need to go to that extreme. But, we all grew up during the HIV, hepatitis stuff where we were observing universal precautions anyway. I just think just don't wear a mask, don't touch your face, and, take a bunch of showers and wash your hands a lot.
Yeah.
But maybe I'm just a typical surgeon and don't care too much.
No, I'm right there with you. It's been, I've heard quite a few conversations or seen quite a few conversations about kind of the medical legal risk here and how to best mitigate that. And I agree with you. I think it's helpful when our associations are, trying to give us some guidance. And I think some are doing better than others. I'll tell you, in the American Academy of Pediatrics, I think I've heard more from our president in this 6-week period of time than I ever have. So it's been interesting for sure.
I think you get a lot of really nervous Nellies out there. And the first thing I hear is, the lawyers are going to have a field day. I mean, I was working on the numbers. I do like 400 to 500 surgeries a year, generals and small ones, and like 1,000 plus injectables, like figure 1,500 patients a year. So I have liability the minute I walk through my door every day. So there's liability. I mean, you got to just observe some certain protocols and understand, have patients sign consent for this. But look, someone's going to get this down the road, but what are we going to do? Just stay home for 6 months and go broke? And the patients are already knocking on our doors to have things done. So, I mean, just be safe and use your common sense. What I really get pissed off about, and this really gets my goat, is all the naysayers who want to play Monday morning quarterback. They want to wait till what you have to say and then say, oh no, that's not good enough. Well, come up with some damn protocols yourself. Come up with the protocols and you give me some advice as to what you suggest rather than just saying no to everything I say.
Jason, I'm going to chime in on that too. We've had some issues with employees saying, well, we want you to show us the protocol. We want you to prove that it's 100% safe. Well, I mean, there's nothing that's 100% safe in this world. I mean, you could pop out on the I-25 and you get hit by a texting teenager. I mean, there's no way that you can guarantee anything. I'm one of those guys that do think the attorneys are going to have a field day with us. I mean, I think the attorneys are sitting back, drinking their fancy sparkling water and calculating how many class action lawsuits are going to place against Dr. Buford and Dr. Posner because they got 9.999 out of 10, but they didn't get that 0.001. And as well as I do, even ASPS and ASAPS, and I assume all the other societies, no one's come out with any really good statements that have said, this is really what you need to do because it's a moving target. Right. So I guess my question, and I don't know if this really has an answer to it yet, is, what do you do? And again, I mean, Jason, you and I have been talking a lot, and I've been talking to other people too, and just asking that question because, we're all a bunch of smart people, but this is a lot of uncertainty right now. And I think that's the real challenge is this is not, surgical things, we can wrap our arms around it because we've seen it, done it. But this is something that's very, very different. This is something that has a new face, and we're just worried about stepping in potholes.
Right. I agree 100%. I mean, the idea would be ideally if you had a rapid antigen test, patient comes in, you test them just like a pregnancy test. So you're negative today, you could have windowed, but you're negative, sign this consent form so we all understand this, and you can still someone come after you for that, but at least it's on the table and it's explained. But it's that uncertainty of what's going on to the patient, what happened to the patient in the few days prior to surgery that you're not sure of right now. Mm-hmm. If they come in and they're IgG positive, good for them. You're not going to get it again. Most likely.
I talked to a patient yesterday and I was joking with her. We had some good conversation, but I said, you're more likely to get this going to the grocery store. Have you stopped going to the grocery store?
Right.
Oh no, I've been to the grocery store. I'm like, well, there you go. That's probably where you're going to pick it up. It's not going to be. Yes.
I said the same thing to someone today. I said that to some staff members. I mean, you're at a grocery store, you're up against people you don't know. I mean, you don't know, they're not screening temperatures in the grocery store before you walk in.
No, not at all. Yeah, I'm with you.
I did go to Home Depot over the weekend, and it looked like a post-zombie apocalypse or a nuclear explosion where they're online and there's 3 people in Home Depot and no one's working there. It was weird.
That's happening here in Colorado too. Well, thank you, Dr. Posner. Thank you, Dr. Buford. Thanks to Andy from Dovetail Solutions who could not be here. And we appreciate all our attendees. Hopefully you guys are getting something out of these weekly webinars. Please engage with us on the Slack channel. We will, again, if you have questions for Andy at Dovetail Solutions, you can post them there and we'll get some answers for you. If there are other topics that you would love to hear in the future, we'd love to hear that from you as well. Tobin, any last remarks?
No, let me throw up a little final poll and I'll just repeat my thanks to you, Dr. Posner. Thanks so much for taking time out. Really great to have you on. Great thoughts. Clearly, you are a leader in the industry and it shows in your comments. And Greg, thanks for inviting him to jump in and for your contribution as well.
Thanks for having me on, guys. I really appreciate it. This is really fun.
And we all learned at the very beginning how to upgrade to the new video virtual background. So if nothing else, that was super valuable.
Yeah, that's good.
No, thanks, guys. Have a great evening, great afternoon, and thanks for joining us.
Thank you all. Bye, Greg. Want to call next. Bye-bye.